question through the chat from Sienna Ali. She's saying, Doctor, how does this affect pregnant or breastfeeding women? I assume the vaccine.
Yes, excellent. I'm so glad she asked this question because pregnant women are at higher risk of getting complications related to COVID-19. It's a very scary time for pregnant women. I'm sure many of you have heard these scary stories that they're pregnant and then they don't make it and the baby makes it and they lose the mother. So these are very touching, heartbreaking stories that we hear about. So in the studies that we just talked about, the Moderna and the Pfizer vaccine, they didn't look at pregnant women in the studies. They didn't look at a lot of immunocompromised people. The only group of immunocompromised people they actually looked at were those who were HIV positive, and they did well. So what the CDC is saying right now is that pregnant women have to talk to their physician, find out, are they really high risk? For example, are you a pregnant female who works in the hospital? Are you a pregnant female whose husband or significant other works in the hospital? What is your risk? Because they don't know exactly what the risk is going to be in immunocompromised people, and pregnant women would fall under immunocompromised individuals. So at this point, it's a decision that a pregnant woman has to make, a pregnant or lactating woman has to make with her physician.
Any other questions from our audience? Oh, so Ziad.
Can I do that? عم بسأل كثير كأنه أنا.
تفضل.
اللي انصابوا بالكوفيد 19 هل من الضروري ياخذوا اللقاح ولا؟
So you're asking if you had COVID, if you got COVID, should you take the vaccine
and why?
And why?
Yes. Okay. I just want to say that these are excellent questions. So when you get COVID, if someone develops COVID, gets COVID and they get very sick, we assume they're going to make some level of antibodies, right? But the problem here is we don't know how long do those antibodies last. Do they last 1 month, 2 months, 6 months? And remember, this is a new infection. So there are studies right now following people from May, for example, onward. There's a study going on right now from people in May. So we're looking at June, July, August, September, October, November, December. We're looking at almost 7 months to follow these people to see, do they lose their antibodies? They lose that protection, or is it lifelong? We do know that some people lose that immunity. We do know that. So the recommendations right now is if you had COVID and you're not still sick from it, that the recommendations are you still get the vaccine, because we won't know if you're immune to, if you have natural immunity from the infection. So the recommendation is yes, you should probably get the vaccine.
Thank you, Dr. Rabha. Any other questions? Dr. Hassoun, تفضل.
Good evening, everyone. Mohamad Hassoun. Dr. Nabha, thank you for very informative answering those questions. Very informative. Thank you. Before, as someone who participated in Moderna's phase 3 study, I would like to share my experience. But before that, I have a question. Maybe you can answer it for the benefit of us all. As recent as a couple of days ago, I heard that Moderna released some information about their vaccine, that those who got vaccinated with the actual vaccine, it seems like their spread, if they caught the virus, it seemed like they don't spread it to others. Can you comment on that? And maybe I didn't put it in a precise medical, scientific terms, but can you shed some light on that, please?
So I guess, Dr. Hassoun, your question is, if you get the vaccine, catch COVID, can you still spread it to other individuals?
Right.
Okay. I haven't seen the statement from Moderna, but there's still, so one of the things we're concerned about is if you go get the vaccine, you're still not out of the woods. There's still a pandemic. We still need herd immunity. We need majority of this country to get the vaccine in order for this country to be safe. So if you get the vaccine, there is still some concern. I do need to see what Moderna said, that could you still catch the infection? I mean, we're talking about a 95% efficacy rate or so. Potentially, could you still harbor it in your nose, for example, not get the infection, and then take it home to your family? That I'm not sure that we know the actual answer to, but I'd be interested to see what Moderna's statement was on recently, because I don't know that they have the actual good data to show us that that's the case.
Okay, thank you.
I'm getting some questions through the chat. One of them from Dr. Abbas saying, have the research found the reason why COVID-19 affects some people severely and others no symptom at all?
Yes. So it's still being worked out. Now, there have been a number of comparisons, right? So this data started from China, and now we have many different countries looking at this. So we do know there are people who get more sick than others. Why does one family member is asymptomatic while another one is completely symptomatic? We don't know, but we do know that there are risk factors that can worsen that disease, right? Diabetes, hypertension, and age are the big ones. We do know that those three, so if you're an older individual, even if you don't have diabetes, your risk of having complications is extremely high. So if, for example, if you're a 24-year-old who presents to the emergency room with fevers and shortness of breath, but your vital signs are stable, they're unlikely to admit you. But if you're someone, I've had several patients this happen to, morbidly obese, older individual, high blood pressure and diabetes, you get COVID, they're probably going to admit you to watch you because you're more likely to not recover. You're more likely to have complications related to that. And it's not just the breathing complications. It's clotting, it's heart issues, it's brain disease, kidney dysfunction. So it really can become a cascade of different types of symptoms and adverse effects.
Well, thank you, Dr. Nabha. I think we could spend hours and hours asking you questions about the vaccine, but for the sake of continuing the, I think I'm hearing other voices. I'm sorry.
Sorry, Adnan. I'm sorry to interrupt you. There was one other question prior to getting the vaccine.
Okay.
Should one do an antibody blood test done to see if they have had the virus, if, let's say, they were asymptomatic?
Right. So I think that kind of is on that same line of questioning someone if you've had COVID before. You don't need to do that antibody test. You don't need to. You should still, even if your antibody test is positive, you should still go get the COVID vaccine because we don't know at what level of antibody is protection when you have natural infection. We don't know what antibody level do you need. For example, I'm going to give you an example. I had a patient who I sent to the intensive care unit. He was there twice. He got reinfected, he went back into the hospital, and I saw him as an outpatient. And he said, let's just for fun check my antibody test. He had documented COVID, and this was a month later. His antibody test was negative. So is that an issue with his immune system or is that an issue with testing? You know, it's hard to say. So even if you do have an antibody, there's no guarantee that you're going to keep that antibody. So the short answer is I would recommend that you get the vaccine.
Thank you, Doc. So moving on, well, there's one more question about vaccination for kids. Someone said, what about vaccination for kids?
Mm-hmm. Right. So, you know, I told my mother the other day, I have 2 young boys, that when the vaccine comes out, I'm going to get them, when it's approved for young kids, I'm going to get them vaccinated. So right now, currently, there have not been any studies in children as of yet that we can document and talk about. The vaccines currently are approved for people 16 or 18 and older, depending on that vaccine. So there isn't a vaccine yet for children. However, I think it's coming, and I think it should be out in 2021 is my suspicion.
Thank you. Building on what Dr. Nabha said, I would like to now ask a question for Dr. Hassoun. Doctor, you've had the opportunity to participate in one of the vaccines experimental phases, right?
Right.
Yeah. And we would like for you to share your experience with our audience and tell us maybe what drove you to participate and what has been your experience so far.
Okay, well, thank you for inviting me to share my experience. Back in toward the end of July, I kind of heard about Henry Ford Hospital running a study on the Moderna vaccine. And, I've been trying to learn before that, what's the vaccine, how does it work, and all that. Obviously, the vaccine, I participated in the study phase 3, which, as Dr. Nabha said, the Moderna phase 3 study included about 30,000 volunteers. Before that, there were earlier phases, and you'd have courageous people then trying the vaccine, and it didn't really, generate any adverse effect serious enough to be concerned about. So I didn't just gamble about it. I thought, it's something we can try. And what drove me to take it is knowing that especially our community, there'll be apprehension about taking a vaccine like this as a new vaccine. And I know many people in the community don't even take the flu vaccine. So that's natural. But, for people just to kind of steer away from a vaccine, especially a new vaccine, or maybe wait till they see the full picture, maybe a year or so. In this case, unfortunately, we can't wait. We're at the peak of a pandemic here. So anyway, so I thought I'll give it a try. I sent an email to the doctors who are running the study, and about a month later, they emailed me back. They said, come in for, do blood work and so on. So in end of August, I went and basically took that first injection. And after that injection, nothing happened. It was just like the regular flu vaccine, just a little bit of soreness to my shoulder. And a month later, so that you would know if you're a volunteer later on, they kind of, it's a study that will last up to 2 years if the participants are willing to stay in it. And they give you a smartphone app on a daily basis. The first few weeks, you need to report temperature, pain, level of pain, and all kind of questions. And then every week, a nurse would call and ask questions also. And 4 weeks after the first injection, I went for my second injection. And after the second injection, that night I came home. I basically had a rough 24 hours, shivers at night, a bit of an elevated temperature, sort of a weakness. That I called the doctor. I was kind of a bit concerned to see, what's going on. He said, he kind of, laughed over the phone. He said, it looks like you get the real stuff. So those are the symptoms basically that you would expect if you took the actual Moderna or Pfizer vaccine. People have been reporting those symptoms. 24 hours, and that was it basically. Took some Tylenol during the next day, and within about 24 hours, it was back to normal. It's been so since the first injection, that was August, end of August, so maybe a good, 3.5, 4 months after that, I feel good, no side effects, and knowing that, looks like, I mean, this is not official, but because of the symptoms I had, it looks like I had the actual vaccine, because I would have a chance of 50-50 to get the placebo. And Dr. Nabha talked about that.